All right, John, we're ready to go.
Good morning, everyone. On behalf of the American Geographical Society Council, our members, and the staff, it's my pleasure to welcome you to this special leadership spotlight focused on tracking movement through space during COVID-19 and beyond, with Dr. Mei-Po Kwan, who is the Professor of Geography and Resource Management and the Director of the Institute of Space and Earth Information Science at the Chinese University of Hong Kong. To those of you participating in the conversation on WebEx and those that are watching on live stream on Facebook, it's great to have you joining us this morning. We are proud to partner our EthicalGEO initiative with the Henry Luce Foundation to investigate the societal implications of geospatial technology and location tracking. Mobile location-based applications have become ubiquitous in our society. As all of you know, they have changed the way we live our lives in a very short period of time. There are, however, problematic and unanticipated effects of using this technology. To better understand the ethical implications of its use, we have provided this platform to frame the discussion and to address these issues as they are already impacting our lives on a daily basis. COVID-19 has put a spotlight on the concept of using mobile tracing and surveillance to fight the pandemic. Around the world, the utilization of this technology to fight the coronavirus is being employed to various degrees, and already governments and people worldwide are faced with the issue of compromised privacy and what that means as we go forward. Over the past several weeks, we have convened 6 blue ribbon panels and looked at the ethical implications of mobile location technology and the impact on vulnerable publics from an international perspective and from the unique American experience. In addition, we had a panel of national security leaders who focused on mobile tracing technology and its use in national security and the impact on democracy. We have also heard from state and local leaders who shared their invaluable experiences with us, from experts on the issue of data quality and building trust, and from the legal professionals examining frameworks informing the use of location technology. In the case of all the panels, the discussions were eye-opening and extensive. We also had the opportunity to hear from Ambassador Samantha Power in a leadership spotlight session where she added the human rights aspect of the use of mobile technology. And we heard from the researchers at Harvard University who recently conducted the seminal study on the use of mobile location tracing in the United States. Today, we will be discussing how various location technologies are used to track human mobility and may infringe on personal privacy during COVID-19 and beyond. This conversation will most certainly help serve as one of the sources of information and data that policymakers will use to help guide us into the future. Before we move on, I would like to explain to those of you on our WebEx platform the best way to get the most out of today's discussion. For those viewing on desktop computers or laptops, we recommend that you customize your viewing by hovering the mouse on the top right of your screen and selecting the icon in the middle. From the 3 options shown, please select Grid View for optimal viewing. During our Q&A session later, to ask a question, hover your mouse under the arrow and click on the question mark icon in the gray bar at the bottom of your screen. For those of you that are using a tablet or mobile device, select the icon with the 3 dots, which will then allow you to select the question mark icon to submit your questions to our panel. And now, It is my pleasure to introduce Dr. Marie Price, the president of AGS and our moderator for today's session, and Dr. Mei-Po Kwan. Welcome, Marie and Mei-Po. We're looking forward to your conversation.
Thank you.
Thank you, John. I am delighted that Dr. Mei-Po Kwan can join us today from Hong Kong at the Chinese University of Hong Kong. She is an internationally recognized leader in GI science and medical geography. She is a fellow of the UK Academy of Social Sciences, the American Association for the Advancement of Science, the American Association of Geographers, and the John Simon Guggenheim Memorial Foundation. She has received many prestigious awards, and this year alone, because of her interest in technology and GI science and medical geography, she's just shared with us she's published over 20 papers. Because of her expertise and human mobility, she has been funded by the National Institute of Health in the United States, the U.S. National Science Foundation, the U.S. Department of Transportation, and the National Natural Science Foundation of China. This is our final spotlight in our Location Tech series, and we couldn't be more pleased to have Dr. Kwan share her research and insights. So she has prepared remarks for us, and then we'll follow with questions and answers. Mei-Po, welcome, and I'll turn it over to you.
Marie, thank you so much, and thank you, John, and thank you, Katie, for organizing such a nice spotlight interviews and conversation. And I'm most delighted, and especially for the people in the U.S., this is after your Labor Day weekend. So I would like to share a few of my thoughts before we have this conversation. Next, please. So pretty much I would like to talk about, my interests, where I'm coming from. I am interested in individuals, focus on individuals in geographic context by collecting very high resolution space-time data. For example, we look at people's movement every second in space and time, and both theoretically and methodologically, I pioneered some studies, and especially, collecting individual data and looking into the person's specific perspective. And then I make use of all these advances in geospatial technologies to enhance our understanding of health risk prevention, and environmental justice. Next, please. And one point that I would like to make is that individual movement in space-time is highly related to the specific context. And it's not just the home, the residence of the home, but where they visit, at what time, how long. And we need to fully understand this relationship between the environment, context, and health behavior and outcomes, including, for example, their COVID-19 risks. So a lot of the times, when we think about COVID-19 and place, we're thinking about their residential neighborhood. But that's not enough, because people travel along in a day, and they contact different people, and also exposed to the disease, and very vulnerable in many different contexts. Next, please. So today I want to say that, we want to understand space-time behavior of human beings, because a lot of the times we talk about a lot of the mitigating measures, a lot of government policies implementing to control the disease of COVID-19. But we are not thinking about human behavior, like the Florida beach, why when people are the college kids are partying, and then they're not observing social distancing, as would be ordered by the, by the state. And also this disease is making the health disparities much more deepen. And then it will be even so, even if the, the disease ends. So we need to think about, what is the geographic context? What is the space and time? What is the different places that is relevant causally to affecting our health and well-being? And I would also like to just pinpoint two very important, methodological issues in the study. The first one is so-called the modifiable area unit problem. That is when we're changing the scale of our study. We see tons of papers on COVID-19, and many of them. But people are using different spatial scale, and then by using that, they may have a different answer. And the other one is what I propose is called uncertain geographic context problem. We are most likely be looking into the neighborhood that they live in, but we're not thinking about other contexts which may be more relevant, other venue, other geography that may be more important for the COVID-19 risk. So I think that I would like to explain a little bit about that. And then also by exposing all this, disease mitigation, contact tracing, and then there's a strong privacy concern, and then it's especially, impacting on the vulnerable population. And then by looking into all this, even beyond COVID-19, we need to be thinking about the future planning, designs, and prevention. Next, please. Yeah. Next, okay, so the first one that I will like, I cannot talk about, for too long because otherwise there's no question time or interview time. But one thing that I want to look into is out of the so many wonderful, research so far conducted, and one thing that geography or GI scientists can contribute is what I call the geo-narrative, because a lot of the time, the experiences of the certain individuals or social groups are not hidden. We may not be, people with resources are being able to cope with the pandemic better than the others. For example, I can stay home, have the whole place, and I can work very productively. Maureen just said I publish a lot of papers, and because I have, I can work from home, my professions and all this allowing me to, so I'm a little more fortunate. But a lot of the other people's experiences are unwritten, and they may have a harder time. For example, their location or places that certain individuals do not go to or cannot go or fear to visit, especially, for example, during this vulnerable time. For example, access to quality food. We can see that, and also for, by low income people, and if they, food desert is a common problem. And in the COVID-19 time, for example, in Hong Kong, we can see that, some neighborhood that's stigmatized, as, like a COVID place like San, and they would, not have food delivery going there, and the postage when I go there, the restaurant will be closed. So the access, to quality food can be very difficult. For female sex worker, for example, in Mexico, and they may have a hard time in access to pharmacies or healthcare services, not so much because they don't have the money to pay for those, for example, prevention of HIV, infections and medicines, like buying clean needles and condoms and etc. But basically, they are really afraid of the police violence happening in there. So it's this fear that constitute all this. So during COVID-19 time, supermarket checkers, they don't have a choice. They go to work and they contact a lot of people, taxi drivers, food delivery, low income racial groups are particularly vulnerable. Yeah, okay, next please, yeah. So how do we use, geospatial technology combined with narrative analysis? And it's that when we're making it into one, then we are actually discovering the experiences of the ordinary people, their feelings, the hidden histories, and the geography of so-called the place-based lives and memories of the disadvantaged people. Because story is the portal through which a person enters the world, and by which the experience of the world is made meaningful, personally meaningful. And how does, I'll show you a few slides, how do we do that? Yeah. Next, please. Yeah. So we basically integrate space and time into this in addition to narrative analysis and perform qualitative analysis. And I wrote the whole software and I designed the whole methodology myself and then with my students. Next, please. Yeah. Using 3 years time, not 1 year, 3 years. Yeah. So, and then I think that especially, for example, sex work in Mexico is, female sex worker are particularly vulnerable because they are subject to police harassment, exploitation. So there are lots of places they're afraid of going. And then also, the hostile environment can be very, so the environment is not just the same to everybody, especially to vulnerable people. So next, please. Yeah. So, and then this is a pretty, complicated methodology that we try to deal with, vulnerable people in infectious disease. In this particular case, is HIV risk. So, and basically we do GS analysis, quantitative surveys, but we also do the number 4 activity diaries, tracing people, and also do qualitative interviews, mapping where places they don't go, and which is the geo-narrative. Next, please. Yeah, I have to go faster now, because otherwise I'm running out of time. So basically what this is the tracing people. The green is the trajectory of time, and then we're tracing, and then we can click on any point on time, then we can show the places they're afraid of, like they go, or how do they feel about it. Next, please. And also, next, please. And also the feelings in space and time. Yeah. And then also the trajectory, color coded by how they feel about the environment. Next, please. And also the places they feel fear to go. Yeah, so the red is where they feel fear to go, and then blue, green, and then that trajectory is where they actually go. So combined with a rich narrative of where they go and what are they encounter in their daily lives, I think that would be providing a rich narratives. Next, please. Yeah. So in summary, so when we're studying vulnerable population, which is the focus of AGS here in the whole series, and I think that the effect of so-called environmental influence on their health behavior tend to operate in the opposite direction and expected of other social groups. And a particular behavior, for example, substance use, may be affected more by a person's time lag, context, and the momentarily context. So that means that the time, there can be a time lag. It doesn't have to be the real time moment. And then apparently the context, is different for different people. Next, please. Yeah. So then what are some of the mitigation measures for COVID-19? Commonly, we can see that there's social distancing, right? So we have to be 1.5 meters apart from us in classroom, in restaurants, etc. The active one are testing. So Hong Kong is doing a lot of testing. However, not everybody, is going to testing, because there's a rumor that maybe the government will send our DNA to China, and so it will be in record and it would not be destroyed. So it also, of course, privacy is a protected promise by the government, but whether people can trust this is another thing. Testing is also contact tracing. I think that we all know that we use location technology, that we can see, who are around us, and then we find those people. The public health is by interviewing. But testing and contact tracing are not useful if you are not doing quarantine and treatment, for example. If you can identify the person, but you're not like separate them and treat them, and then they keep on going into the community, they keep on infecting people. So this is actually what is happening in the American colleges. And then I think that at UIUC and some other university, we test people, but and then they're not, they may not necessarily doing quarantine and treatment. And then the people who are tested, also by clinics, and may not, may still go out, in the community, may not be helpful. And of course, wearing masks and hand sanitizing. Next, please. Yeah. So then what is the part, how does we use technology? For example, in-depth interview with patients, we can record the location and map it in a GIS. The mobile phone location tracking data of patients, we can, with the mobile phone, the cellular phone, we can actually track people every second, every 10 seconds, every minute, with very precise let long and time. We can create a trajectory, and then, we can know that who they go to, and then, maybe identify those places. Credit card usage also can record where people go to, and also facial recognition, the famous facial recognition, right? And so when you're around in a, confirm the patient, and then they take a, they can recognize you and trace and find you. And also now, it doesn't just need the face, because everybody wear a mask. When everybody wear a mask, and actually with voice combined with voice, and they can actually find also identify the person. So this is a very strong, and with the background images, they can identify the location. Next. And all these are pretty scary technology, actually. This is Hong Kong. I apologize for the Chinese, but my point here is that in Hong Kong, the data can be at a building level. So we can have, the first one is man, 61 years old. It's a close contact of imported cases. Imported cases are Hong Kong residents. And the blue dot, the green dot is, they have been the building that they have been in the past 14 days, and then the red dot at the buildings, and they live or they visit in the buildings. We've combined it with some media. What floor, because they usually say what block, because then in what block they may have some kind of environmental contamination. Then with the age and with the male and all this information, they live alone and etc. Then they pretty much can identify the individual. So we heard people saying that, oh, that person has COVID-19. And then that may cause a lot of, stigmatization that for the individual and also for the whole building. Yeah, so building level is a little scary. Yeah. So, but we actually publicize it. This is in a dashboard, by the way. It's you can see it update every day. Yeah. Next, please. So, and all this geospatial data used is tracking that by interview or by asking or by GPS. GPS trajectory is linking the whole daily life, of persons. And mobile phone data is actually, you can buy them around the world, but of course they don't release it at, latitude, longitude, X and Y level. They pretty much aggregate it before they, give it to you, so I can buy that too. And in travel card data, like Octopus card in Hong Kong, and they pretty much, have precise travel data, movement data too. In the past, people are very sensitive about Octopus card data. They don't want to release it, but with COVID-19, actually, we can get Octopus card with a public health concern. Social media data, when people get quarantined, they may have a wristband. But the wristband has some problem. The location data are not so, accurate. CCTV facial recognition I already talked about that. So when I say that the key point here is that actually just like computer, right? You can protect it, but you can hack it. With identification of the location may be possible. Next, please. Sorry, that is, I want to say a little bit more about the re-identification. So if you have GPS tracking data of people, even for a week, they always come from a place in the morning and come back to the same place. And you pretty much, and then it repeatedly, then it's their home. And if they go to a place in the daytime, repeatedly for 5 days, then it's pretty much their work. And so gradually, you can pretty much find out who that individual, and we identify all the location. So GPS data and location data can be re-identified, and that is scary because and then you can find the individual, you can trace what they do. And so then what is, the methodological questions that I would like to raise is that, so when we are having some findings on individual behavior or outcome, for example, we are looking into what is the relevant context. How is it geographically delineated? It's very important that we don't just look at the home, but we're actually looking into where they go. That's why GPS tracking can be very useful, because we find out that a lot of the venue that people contact COVID-19 is by the venue of a bar, for example, is when the moment when they take off their masks and very happy and stay for quite a long time with their friends. The modifiable area unit problem I already talked about is the scale problem, and zonal scale, that is, you define the spatial unit differently, and then you may get a different answer of your study area. Next, please. So this is the same that what I talk about, spatial and temporal uncertainty. Next, please. Yeah. And then I think that why are we studying that in geography? Why do we think that this is important? Is that we can generate knowledge about the why, how, where, and when, where and when, like is the relevant context that people contract the disease. But also we can understand why, what are the environment that are risky and how, etc. So about the neighborhood effect and all these people context. Next, please. And this is a particular, this is a demonstration. Jia Wei Wang and I, we construct, the cases, to the extent that possible in Hong Kong. So by, using multiple sources, and we did, this is a free cases, free friends gather around in a bar that is the big circle, big red circle, the contact place. And then the three of them contact, like COVID-19. By the way, this is real data, but we are devoiding the geographic background, so you probably cannot really, hopefully not. But it's published, like it's all there, the information. So in Hong Kong, so they are going from home, and at the end, then they come back home, but some of them go to the hospitals, eventually. So you can see that, like case 2 and case 2 and 3 actually work together in the same place, but they didn't contact the disease in the workplace because social distancing are quite okay. But in the bar, all of them contacted each contracted disease. And case 3 actually doesn't move around very much, the green dots, but and then I think just went to the bar and then got contacted. So what is the venue and what is the relevant space and time is very important. Next, please. Yeah. Then leads us to a thinking about so-called activity space, and there are many different GIS way to create activity space. And then this is one example. And then this is the normal places that people go to using different ways and of GIS construction. But if you overlap the activity space, you can find out a lot about people's risky, who's contacting who. Next. And this is another way of creating what is other than home, than around the route they're traveling and also all the places they go to. Next, please. Yeah. So then what is the privacy concern using the GPS data? First of all, I think that it's possible to identify a person's identity through reverse geocoding. If you reverse, the location, and if you know enough data, that you actually can reverse where the person lives and where they work. And then that means that, combined with credit card or other information database, and the person's identity can be revealed if data are not handled carefully. So in country with strict human subject protection, then all person in collecting and analyzing data go through rigorous human subject protection. They apply legally to participate privacy and data confidentiality. But I can tell you that with COVID-19, this not at the university level, not the ILB, but a lot of the government are, trying to publicize a lot of this data, and that we in China we can actually also reconstruct, a lot of this locational data and the person's identity by reverse geocoding. Next. So then what is the tendency between disease control? On the one hand, we want people to know where the confirmed patients visit. But on the other hand, we want to protect people's privacy. And in Hong Kong and Korea, people are more willing, to accept contact tracing for the personal social benefit of disease control. But in the US, European countries are far more reluctant. Next. And this is just a quick look at 80 papers, and then North America, European countries, the spatial unit are much bigger, county level, state. But whereas in the China or Asia, there's more cases that can be trajectory data. And then if you can see that there's a lot of modifiable area unit problem that can arise from all this result of these papers. Next. I think I have to be faster. Yeah. Next. Okay. So then, what are some of the possibilities? I just want to go through very quickly. Voluntariness. People can test positive, must consent to any data sharing. by the apps. But the problem is that, like if you let that people choose, then some confirmed the patient may not tell you where they have been or who they contact, and then you have some people walking around and then may be infecting other people. You can just say data are not used for the purpose other than public health. You can say I'm doing minimization. I will destroy all the data, and it has to be transparent. Next. So, and then what is the impacts on the vulnerable community? So for example, if we use big data, like mobile phone data, social media data, then we are devoid of the social and geographic context and the demographics, right? And then the usefulness for the vulnerable population is in question. If we disclose the sensitive, precise data about the vulnerable communities, vulnerable individuals, then we can increase their vulnerability because they can be stigmatized and then be people avoiding them and and trying to say bad things to them. And then the trade-off between privacy and protection and analysis are really needs to be at the appropriate level, and protection of geoprivacy is needed. Yeah, next. And that's why in the US, a lot of the COVID-19 research is not released at the neighborhood level. And then it's a county level, but county is so big. And then there's so many ecological policies, so many mixing. So this is a means to protect people and also to trade off about the accurate spatial analysis. So I'll just flow away a few things very quickly. Again, I think I'm running out of time. I don't want to talk forever, but I'm a little slow at night when I'm talking. Yeah, I thought that I'll be faster. Yeah. So first of all, it's the Bluetooth. It's privacy preserving. Bluetooth is just knowing where people are around you. And if you agree to give out the data, then you can be notified when in your vicinity people actually get infected. So this is a privacy preserving one. The disclosure risk assessment based on activity space and GPS trajectory. We actually develop some methodology to protect the GPS trajectory, the precise location. And then we can also build data infrastructure. For example, not just like a physical enclave, but we can do some virtual enclave and put the data there and then trying to protect it. By the way, this is a project that we're working with Harvard University and also ICPSR at University of Michigan. Next. I think that, I'll just skip the details, like different Bluetooth contact tracing initiative. Next, the Apple and Google one that is making quite a lot of media news. Next. So this is, like a risk disclosure risk of GPS data, then how can we mask it and how can we actually assess, the risk and then minimize the risk for, like a sharing of GPS data. And it is a published paper. So if you're interested in the methodology, you can go to it. Yeah, next. Then finally is like Geospatial Virtual Data Enclave project that I work with, like Harvard University, Dr. Douglas Richardson and Dr. Maggie Levinston at ICPSR. And basically we are building, like a secure data enclave and put the data there. Next. So the conclusion is that we need to better understand of human space-time behavior, because even though we have contact tracing, it doesn't mean that people are observing to it. If we have social distancing, but some people at some point are not doing it. We need to have a more bottom-up approach to address the prevention of disease and mitigation measures, especially for vulnerable population, develop risk assessment method, and also confidential data sharing infrastructure, and also better understanding for the future of COVID-19. I think that we, even beyond it, there will be more pandemic. Air pollution also will be there. People will be wearing masks a lot more. So, and then and also there's fire in California. So I think that the like this all this that makes us to have a better understanding of the nature and also the build and the social environment and how does it affect well-being. For example, do we need to build different green space or different living environment in order to have a better planning beyond COVID-19? How can we handle, the vulnerability of, low-income people or people that is heavily impacted by the disease? I think is something that we need to be thinking about. So I think I'll just stop here. Thank you. Yeah.
Robust summary of all the research you've done, and it demonstrates the depth of your understanding of these critical issues of privacy, vulnerability, and how you can advance GI science to address these really pressing concerns. One of the things I've always admired about your work is your integration of both the GI science and the sort of qualitative geo-narratives, and that it isn't just about location, but who is in that location and how it varies based on gender, race, profession, those vulnerabilities. Having done research on sex workers and drug abusers and their particular context, I'd love for you to talk about how, in working with these obviously vulnerable communities, how do you protect them from harm in doing geospatial research? Could you share that?
Yeah, it's a very good question. So I think that I work with mainly, a lot of the research projects I work with is vulnerable population, and they are actually at very high risk. For example, I have location data on drug users, where they deal the drugs, where they buy them, where they use them. And then if the police, and we are talking about Mexico, and if the police and Tijuana and those places, and if the police find out, then some people will get killed. So it's very important that we actually protect their privacy. It's not just about, somebody know that, somebody has HIV infected and or COVID-19 infected. So you don't want people to get killed. So what we do is that, first of all, we have to go through very rigorous IRB, approval. And in that we have to promise that how do we store the data? For example, after we collect them, we have a map room that is 4 walls, no window, and then no internet. I mean, the grad student usually cry when they go in because no internet is no window is okay, but no internet is really, because it's not secure enough, right? Because to protect the internet. So we have to, we are more coming, we have promised confidentiality. So we work with the people and they trust us. Yeah. So I think one thing is that you said that how can you get all this data? We have sex worker telling us, how can they get encounter violence against them and then get infected HIV and then the whole, process of sex work. Yeah. So it takes a lot of trust to get those data, and then we protect them. So so we have to first of all store it in a secure place, and we mask the data. We don't share them, and then if we use it and then we destroy it, after the fact. So I think that basically, we have to be just observe all the rules. Yeah. So we have many ways. If we are transmitting data, why we are collecting the data, that we have to make sure the server is secure and etc. Yeah.
I think that's the concern for trust is a big issue related to how tracking is done and concerns about privacy and who controls the data and for how long. And these are some of the issues that we've been addressing and hope to put out guidelines. Should this data be maintained forever? No, it should be used for the period and then destroyed. And these sorts of questions are certainly circulating. They've circulated among the academic community and now sort of a broader public health and public discourse. So contact tracing is the area where technology and fighting COVID have come together. We've seen location data used to analyze social distancing measures. Based on your research, how would you propose location data analysis can help the fight of COVID without making the public anxious about too much data being extracted from their daily activities?
I think one thing definitely is the privacy preserving Bluetooth technology. Yeah, that is, that doesn't really record your location. It's just like saying that how far away that people are. And that is can be used in many, many different ways. For example, when people, even after COVID, they go back to work, there's still a possibility of, like of infection because you don't know whether it's totally gone. So social distancing is still important, and then that can help the employers, for example, knowing that whether people are really keeping 1.5 meters or whatever distance they are at work, and then they will beep you, then tell you that you're violating the distancing, and also in the Bluetooth technology, and then if somebody so happen to get confirmed that and all the people that within the vicinity in the proximity can be also, can be also be identified, notified at least, like that, like that you contact, you're within a certain proximity from a confirmed patients now. So I think that there will be more location-based services. So people are already talking about, having, like, at one point, masks is very in shortage, right? So where to buy them? The elderly people cannot, really line up for overnight, they line up overnight to buy a mask. So I think that, like with some apps, you can tell them what is in your vicinity. Actually, that there's some masks available. Avoid some restaurants when people actually some confirm the patients are going have been gone. Real-time information on some opening hours of some facilities or resources or less crowded places. So I think this is all the technology and location information can be using. But of course, like facial recognitions can be becoming, like another point that to identify people, but also there's a heavy geoprivacy, kind of concern. So we are thinking about, I think, a new normal, right? I mean, like, so we may still wear masks. We may still, trying to be careful in some public, have a lot of public health concern because that can be another virus. Yeah. This is corona, right? I mean, COVID-19, but it can mutate. It can, even if you have a vaccine, then maybe the virus is already progressing quite a lot. So I think that all this new normal, how do we live in the public space, behave in the public space? I think all this needs to be rethinking. And I think location information can help to identify, again, as I have said, what is the relevant, spatial and temporal context that can make people risky, or what are the risks, what are the venue or place and space that make people's behavior more risky. The same person can behave very differently when they're with friends in a bar. Like I think that like we have to do more research on that, but that can be very important to know and then to prevent the disease in the future. Even though when COVID is dying down, but it can come back, or it come back with a new way, and then we believe that even the WHO said the pandemic will come again. So we just need to be more prepared. And I think location information can be a good way. Yeah. As a
One
long,
of the
long, answer. Yeah.
One of the questions that has come up already from our listeners is the kind of places where risk is higher. And you've mentioned bars a number of times, and that's out there in the media. Is that something that's shown up in your data as well? Certain kinds of places where people let down their guard, they're indoors. Is that how we should really be talking to the public too? Not just about distance and wearing masks, but certain kinds of places are much more vulnerable and risky.
Yeah, I would say that more research is needed, but like according to what we have done, different culture may have different contexts. Like for example, Hong Kong, like the restaurants are very dangerous. Yeah, people like like to go out to eat and our socializing around restaurants, meals, right, family and friends, and then it keep on the third wave keep on happening. It's actually the restaurants and some to some extent it's the bar, but not everybody goes to the bar. But in Hong Kong, everybody go to restaurants, right? So and then I think those are very cultural. And then in the U.S. among different population, I think that in this again it goes back to my point about geo-narrative sensitive or vulnerable population, we should not be generalize or totalizing a particular place, but it's definitely, people have less resources, are more vulnerable. We also have done some, research on green space, blue space, density, whether a high density, high building, a certain, geographic environment would be making people more vulnerable. Yeah. And then, so using more spatial statistics and etc. Yeah. Yeah, so I think that what we should be doing, I think, again, it should not be generalized. That's my first point. And secondly, I think we do need more research. But in general, yeah, I think we can have some, something to say. Yeah.
The one of our main interests has been in contact tracing, and it seems that in East Asia, especially South Korea, there's more public acceptance of contact tracing, where in Europe it's been tried but stopped in some countries. North America, it hasn't really caught on. So that cultural component of what are groups of people feel socially acceptable, I think we're a long way from having contact tracing, at least in the US context, be widely accepted. What's your view and experience from the Hong Kong perspective?
I think for the Hong Kong perspective, I think people are more willing. Usually, it's done by the police. I mean, when somebody got confirmed, and then people, they will, like trying to trace, and they even using a supercomputer, I think, to trace people, and it's quite accepted, except for maybe when people like have some like crowdedness, like for example some quarters, and they live many people, and they in and out, and they just really cannot cannot really trace. So I think that in general, we have done some research in and also look at some papers on Korea and Hong Kong, and they're more acceptable, like for identifying their contact, and also locating them than the US and Europe. Yeah. So I think it's probably, first of all, there's stronger regulation in US and Europe anyway for location privacy. But I think that is also, I think it's the collective memory in Hong Kong of SARS. Yeah, back 16 years ago, it was so bad that people would say, like, okay, public health concern, they're really afraid of it coming back again, because the memory was so bad. And and in Korea, I think the collective action to provide the society with a collective goods, is very important than maybe personal privacy. Yeah.
I think that's a big, I mean, we haven't had a pandemic really affect us. I mean, the people talk about 1918 and 19, but, mask wearing has not been a common thing in the United States, and trying to get people accepting that and doing it is been challenging, and very uneven spatially. So the other debate that has come up is, who controls this data when it is collected from, some of these private companies? Apple and Google are promoting this Bluetooth method. Is this something that government should have the final say in, or the private sector, or how do the government and private sector collaborate? And then government, of course, has many different scales, and ultimately for public health, you have to get down to a more local level. So can you talk about that, about the responsibility of those two larger units, and maintaining a system that could prevent the spread of COVID, but also not ensure privacy?
Yeah, so I think that first of all, we can talk about private company is doing a lot, right? But they do not have a regulation. They don't have IRB, right? So when I say that I am strictly regulate when I collect my data, then I have to follow everything. Otherwise, my whole research, enterprise will be shut down. So it's a big consequence, and then we won't violate that. But in the private company, they can collect data to prevent the disease, but they can also sell it. Like facial recognition, right? So they pretty much, get in order to do that, you have to get a lot of, like photos, 3 million people, well, sorry, not million, billion photos, in order to, really find out, the persons, right? So, and then, they collect all this photo without asking you. Right? I mean, did they ask you? I mean, you are on Facebook. I'm sorry. I mean, some people may be watching from Facebook, but I mean, they can get the photo without asking Facebook even. Yeah. So, so that is a really like a big concern. And of course, like the government is doing contact tracing. They have the data, but for example, in Hong Kong, they're more willing to give it up. Put it on the dashboard. You can locate the building. You can locate the persons, and then so that people can be aware of the disease. Don't go to that building, or the whole building is panic. By the way, actually, I quarantine my staff when that building has confirmed the patients in my institute. So they have to be, and the banks too. When not the person, but the building they live in. So we quarantine them for 14 days. Yeah. So it's a very strict world, right? I mean, so, and then I think that the government may have a responsibility of keeping it, but it really depends. In the United States, I think when NIH, or the government agency, health agency, when they, deal with data, they also have to observe some kind of ethic, things. However, sometimes like for example, in Hong Kong, I don't think that there are many geoprivacy, except that the public will say, "Oh, you are not getting my data to give it to something to track me on some other purposes." Like then because I mean they can be very also location data is very sensitive. In Hong Kong too, for example, yeah, because of all these protests coming and arrests, and so I think that people are also like frightened that those can be, like used it on that way. So the government should be responsible, but if it can be more transparent and regulated, and that would be better. Yeah, I think. Yeah.
An interesting question has come in on integrating individual case studies with larger group behavior. And in particular, have you or do you know people that have analyzed the impact on a policy, let's say mandatory mask wearing, and its impact on disease transmission and in particular settings? So are we getting to that granular understanding so that we could affirm policy practices?
Yeah, I have done some, but with others, I mean, with my co-authors, but a lot of other people have done quite a lot. I think basically what we did is that we compare, like one paper that we have done with a group of co-authors of, collaborators, and we are looking into, like different kind of policy, very strict, control and reopening time. So if we reopen earlier or later, and what is the impact on the economy versus the disease control? But I also have seen other people have done, those, policy implications, big policy using agent-based modeling and etc. So there's quite a lot of work going on. Yeah, not just my own, but others. Yeah.
And another question has come in about why, and this is someone said in the region they're in, I guess Southern California, there's a real reluctance for people to share information with the government, and they see these sort of contact tracing as doing that. Same people might willingly share information on Facebook or other social media, but what would you say to someone that fears the government's going to do something with this data? What measures would you like to see, or could you put forward to say this could be used in a way that will be helpful and not harm you? I know that's a big question, but what do governments need to do to assure people that their information won't be used in a way against them?
I think first of all, the government should follow certain kind of guidelines. I think I list some of the guidelines, right? So if they can say that it can be very transparent what they're going to use the data, they'll destroy the data, they will minimize it, like just collect what they need and use it only for public health purposes. And then if it is transparent, I think then I think people should, like contribute, to the public health concern. But I think that sometimes, I can see that, I collect a lot of, very sensitive data all the time. I can see that, particular groups are very reluctant. For example, African Americans. It's very hard for them, to, give you the data. Very, very hard. Minority, yeah. Vulnerable groups, extremely hard. So if you, for example, I use a lot of representative, like metropolitan level, random sample. And then usually African American and some of the minority group are very, very underrepresented. So we have to use very, as like small sampling, kind of targeted sampling kind of method to collect those data, just like what I said about, the female sex worker, those things. Yeah, so I think, it is true that, there's a very big non-trust towards the government at some point, especially from certain populations. So I think the government should do something first. So they should guarantee or make it transparent what they're going to use the data, and they're not going to change it, for example. Yeah, because a lot of the COVID data, GIS scientists, and then publicize some data, and some government may not want to publicize it. They may change it a little bit, maybe not a little bit, but a lot. In some cases, in some states, yeah. So they don't reveal the true numbers. So I think that if they keep on doing that, and why should people trust them? Right. So I think that, on the one hand, I think the government should work with the people. And also make it very transparent. So I think that it would be good for the whole, public health issues. Yeah.
And as you said, we're probably going to be revisiting similar if once COVID is behind us. There's likelihood of other pandemics or natural disasters, ways in which knowing location and trusting and data being used appropriately will have real benefits for people. But they have to have faith in the system, which right now is very low in some places. I'd like to change gears a little bit, and a lot of people listening are academics, but people in government as well. The United States, at many universities, are using contact tracing apps for their own population of students, faculty, and staff as a way to protect people and warn people. What's happening at your university, and how are they handling COVID?
At my university, we are doing a health declaration. We just voluntarily fill in some forms telling when we leave the country or the place, we leave Hong Kong, and also how fill in our health conditions in the 14 days. And then I also, change it to 21 days for my own institute, because I think 14 days is not enough. And by quarantining, so we are just doing everything more voluntary, reporting. And also only if you left, and then we do contact tracing only, not by ourselves. I think we just know that if we just quarantine this people who is got confirmed it, if it's confirmed it, then we tell the other people to to maybe get some testing. But I think that basically it's done by the government. If there's a confirmed cases, all the close contact will be tested. And if one close contact is tested positive, then all that person's, colleagues or whoever, then family would be quarantined. Yeah. So it's
they'd be informed and then quarantined.
Yeah, right. Yeah, but not so much by so-called the universities. So we'll do something, but if it's happened in one workplace and all the workplace people are told to be testing or maybe not coming to work, but we pretty much work from home anyway. So we're doing online courses. So yeah, so they will be tested. Yeah, yeah.
Well, we're also in my university, George Washington University, we're all remote as well. And so I think that's, it might be I don't know the majority, but probably close to half of university students are online right now, maybe more. So one of the values of doing this webinar is that we'll make it accessible if people want to hear about this and talk about this issue because it's so relevant to all our lives, how we respond to COVID. I am afraid we're out of time. An hour flies by when you've got so much to say, Mei-Po.
Yeah, thank you for.
I give you the last word. Anything else you'd like to add based on your research? And then I'll wrap up.
Yeah, I think there quite a lots of research, like analyzing, the how to stop the disease control. But I think basically, what I really want to think about is in the future, how should we plan our city better? How should we allocate resources and also put in, the spatial arrangement of a city? Do we still having the same green space arrangement if that is a pandemic comes? How about the hospital, accessibility to hospital? Do we have enough capacity to handle some of the, emergency? And then how do we, access and help the vulnerable population? So this time we are like doing it very ad hocly, but in the future, can we do better? I think geography has a lot to do with, with the learning of this research. That's why we are doing research, right? I mean, because by the time it's done, maybe the COVID is gone. But, we should be thinking about the future. How can we make our city much more healthy and also more ready for the pandemic? Yeah. Or for the next one or in the future. Yeah.
Right. So that vision of sustainable, smarter planning and thinking that there'll be, if not an epidemic or a pandemic, other natural disasters, we need to think ahead. And that's a hard thing for us to do, but I'm glad you threw down that challenge. I just wanted to thank you, Mei-Po. As always, you have so much to share, and let our listeners know that this Location Tech Task Force, this is our final event. This event was made possible, as it was all the other talks, through a generous grant from the Henry Luce Foundation, and we're extremely grateful for their support. So many of you know that this is part of the American Geographical Society EthicalGEO initiative. And you can go one word, ethicalgeo.org, and you can see all the prior talks. If you click on them and scroll down, you can see they've been recorded. There's also a very robust knowledge base. What is the term we use? Basically a working bibliography of reports, articles, newspaper stories that in this repository that is really on this topic of location tech and fighting COVID. And several of Mei-Po Kwan's papers are in that knowledge repository as well. So please use that resource. It's freely accessible and could be valuable in your future research or sharing with your colleagues and students. And with that, I say thank you very much. We appreciate your listening and your questions. And please stay in touch. You can always write to us at the American Geographical Society, share your ideas, become a member, and stay involved in this important effort. Thank you, Mei-Po.
Thank you, Maria, and thank you everybody for coming. Yeah, joining. Right. Yeah. Bye-bye.
Bye-bye.
Stay healthy.